Welcome to the We Level Up Treatment Center video series. In today's video we will discuss personality trait versus personality disorder. The main difference between a personality trait versus personality disorder is one of severity and consistency. Personality traits reflect people's characteristic patterns of thoughts, feelings, and behaviors. In addition, personality traits imply consistency and stability. Someone who scores high on a specific trait like extraversion is expected to be sociable in different situations and over time. A personality disorder is a way of seeing the world that deviates from the norm and means you have certain behaviors that negatively affect all of your life, all of the time, since early adulthood. Someone with narcissistic traits might be cold and ruthless at work but kind to his children and friends. Perhaps they only became so brutal after a big promotion. Someone who has narcissistic personality disorder would be unable to empathize with anyone in any area of life. They would have been this way since late adolescence. Mental illnesses are not adjectives, nor are they insults. But people with personality disorders tend to particularly feel the burden of how our semantics stigmatize the mentally ill. People are quick to hurl terms like schizo and narcissist. But there's a knowledge gap when it comes to an understanding of the symptoms of personality disorders, PDs. First off, it's essential to know that there is, in fact, a big difference between personality traits and personality disorders. So, for example, it may be difficult to understand or distinguish someone acting narcissistic from someone with narcissistic personality disorder. And yes, some people like to stay at home, but antisocial personality disorder is deeply misunderstood and doesn't usually include shyness as a symptom. 6 things that differentiate personality disorders from personality traits. Possessing flexible traits versus rigid traits. The symptoms of personality disorders are less flexible than personality traits. While some may speak to the contrary, personality traits can, to some degree, be changed. For example, personality traits like being outgoing are a little more plastic, meaning that a person could be aware that they are outgoing, which is unlikely but could change over time. But personality disorders, on the other hand, are more established. Having empathy versus a self-centered point of view. Stepping into another person's shoes is tricky for people with PDs. People with personality disorders cannot see the world from other people's perspectives. This can be confusing for people struggling with these disorders. Having one isolated trait versus a group of traits. You may have 1 or 2 familiar traits that share diagnostic criteria with a PD, but that's not enough to indicate a disorder. Personality disorders include a specific set of characteristics that show up together in someone's personality. To ensure that PDs are correctly diagnosed, professionals look for these traits and how they appear in social situations. They will look for the clusters of characteristics that are pervasive and harmful to successfully maneuvering interpersonal problems, work stressors, and family crises. For example, it's one thing to share a feeling of superiority and another to have a cluster of traits that make handling social interactions impossible. Understanding others' behaviors versus never understanding them at all. The way that PDs present themselves is often due to what caused them in the first place. Underlying the PDs, professionals usually find trauma, cultural, interpersonal, violence, sexual and physical abuse, family trauma, anxiety, and depression. When someone has been through this pain, the person living with a PD is often scared, lonely, and unsure why some behaviors get the opposite reaction they may be seeking. After a while, it becomes difficult for the person to understand how others behave. Having coping skills versus avoiding pain at all costs. People with PD tend to change their behavior to avoid pain constantly. Protecting yourself to avoid pain is common, even for people without a diagnosis. We all overreact at times and hurt ourselves, maybe in smaller ways. The difference is the ability to use coping skills and accept one's quirks and reactions while figuring out what to do in each situation. While you can bounce back from an uncomfortable situation, a person with a PD might not have that luxury. Keeping relationships versus losing relationships. Due to this gap between their inner world and the world around them, people with PDs tend to miss out on interpersonal relationships. Living with a PD can significantly disrupt all relationships, not just romantic ones. This disruption can manifest in conflict, infidelity, moving quickly from one relationship to another, rushing into relationships, avoiding relationships, or cheating. Symptoms and signs of personality disorders. Interpersonal functioning problems typically manifest as failing to develop or sustain close relationships and being insensitive to others, e.g., unable to empathize. People with personality disorders often seem inconsistent, confusing, and frustrating to people around them, including clinicians. Interpersonal functioning problems typically manifest as failing to develop or sustain close relationships and being insensitive to others, e.g., unable to empathize. People with personality disorders often seem inconsistent, confusing, and frustrating to people around them, including clinicians. These people may have difficulty knowing the boundaries between themselves and others. Their self-esteem may be inappropriately high or low. They may have inconsistent, detached, over-emotional, abusive, or irresponsible parenting styles, leading to physical and mental problems in their spouse and children. People with personality disorders may not recognize that they have issues. Types of personality disorders. DSM-5 groups the 10 personality disorders into 3 clusters, A, B, and C, based on similar characteristics. However, the clinical usefulness of these clusters has yet to be established. Cluster A is characterized by appearing odd or eccentric. It includes the following personality disorders with their distinguishing features: paranoid, mistrust and suspicion; schizoid, disinterest in others; schizotypal, eccentric ideas and behavior. Cluster B is characterized by appearing dramatic, emotional, or erratic. It includes the following personality disorders with their distinguishing features: antisocial, social irresponsibility, disregard for others, deceitfulness, and manipulation of others for personal gain; borderline, inner emptiness, unstable relationships, and emotional dysregulation; histrionic, attention-seeking and excessive emotionality; narcissistic, self-grandiosity, need for admiration, and lack of empathy. Cluster C is characterized by appearing anxious or fearful. It includes the following personality disorders with their distinguishing features: avoidant, avoidance of interpersonal contact due to rejection sensitivity; dependent, submissiveness and a need to be taken care of; obsessive-compulsive, perfectionism, rigidity, and obstinacy. General principles of treatment. In general, the treatment of personality disorders aims to reducing subjective distress, e.g., anxiety, depression, is the first goal. These symptoms often respond to increased psychosocial support, including moving the patient out of highly stressful situations or relationships. Drug therapy may also help relieve stress. Reduced stress makes treating the underlying personality disorder easier. It should enable patients to see that their problems are internal early. Patients need to understand that their problems with work or relationships are caused by their problematic ways of relating to the world, e.g., tasks, authority, or intimate relationships. Achieving such understanding requires a substantial amount of time, patience, and commitment from a clinician. Clinicians also need a basic knowledge of the patient's emotional sensitivity and usual coping methods. Family members and friends can help identify problems of which patients and clinicians would otherwise be unaware. Behavioral change is most important for patients with the following personality disorders: borderline, antisocial, avoidant. Behavior can typically be improved within months by group therapy and behavior modification. Limits on behavior must often be established and enforced. Sometimes patients are treated in a day hospital or residential setting. Self-help groups or family therapy can also help change socially undesirable behaviors. Because family members and friends can act in ways that either reinforce or diminish the patient's problematic behavior or thoughts, their involvement is helpful. They can be allies in treatment with coaching. At We Level Up Florida Treatment Center, we provide world-class care with round-the-clock medical professionals available to help you cope. Call today to speak with one of our treatment specialists. Your call is private and confidential, and there is never any obligation. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.